Okay, so let's attempt to take a look at the model of the human respiratory system. So first thing we're going to do is take a little closer look at the upper part of the respiratory system here. And you can see here is the hyoid bone. And below the hyoid bone, you can see the larynx. Parts of the larynx you can actually visualize on this model. The thyroid cartilage is right here. Here's our laryngeal prominence, otherwise known as our Adam's apple. And then below here, here's your cricoid cartilage. Below the level of the cricoid cartilage, you can see the trachea larynx. The trachea is the fancy anatomy term for the windpipe, and it's composed of these hyaline rings held together by membrane. Okay. Now if I pan backwards a little bit, and if I hold this in place for you because you know what our models are like, now you can see that there are actually two lungs. So let's take a look at the right lung. Remember, this is anterior view, so this is patient's right lung over here. So I get in a little closer, and I let the left lung fall off a minute. You can see that the patient actually has a lung that's composed of three different sections. These sections are referred to as lobes. So you have a section on the top, which is referred to as the superior lobe of the right lung. You have a section in the middle, which is referred to as the middle lobe of the right lung. And then you have a section on the bottom, which is referred to as the inferior lobe of the right lung. The middle and inferior lobes are separated by this oblique fissure, and this superior and middle lobes are separated by a horizontal fissure. Now, on the left side of the lung, there are only two lobes. You have the large superior lobe of the left lung and a smaller inferior lobe of the left lung, and they're separated by this oblique fissure here. The left lung's smaller than the right lung because guess what? Ta-da! The heart is taking up real estate. It's in the center of the chest, but it's angled to the left side, so hence left lung is smaller. If I go ahead and do a frontal section, i.e. a coronal section through the lungs like this, and I go ahead and pop the heart out, you can go ahead and see there's this space created. This is the real estate for the heart, and it's referred to as the cardiac notch. Sorry about that. Okay, now if we take a little closer look here, you can see once again we have the windpipe coming down. The windpipe comes down here into the thoracic cavity, and it ends right here at this triangular piece of cartilage called the carina. And the carina is the joining spot between the trachea and the main or primary lung lobes. We have one on the left and one on the right. Now, these primary lung bronchi, or primary or main bronchi, branch off into secondary or lobar bronchi. And they're termed lobar bronchi because there's one per lung lobe. So since there are three lung lobes on the right side, you have 1, 2, 3 lobar or secondary bronchi. And on the left side, there are only 2 lung lobes. So you have 1, 2 secondary or lobar bronchi. If I pan out a little bit, you can see that those bronchi branch even further. Once they get into the lung lobes, they branch again. This one's a cut surface because it's coming at you in 3D, right? Now, these next branches are referred to as the tertiary or segmental bronchi, okay? And then from there, they just keep branching. But you know what? We're going to stop the madness there at the tertiary bronchi. So I'm going to pan back a moment so that you can see the lungs in all their glory. And there you go, the human lungs.